So to set up a patient on the ECG monitor screen, you'll remember your channel number from the back of your ECG monitor. Ours was 802, so it'll say channel, it'll be CH0, and then your number. As you see on the screen, it says discharge or admit. You're going to pick admit. And then it's going to take you down to this bottom screen. So you'll see it'll start reading up here, but we have something that's very important we have to add. You do not always have to add an ID number for your patient unless you have multiple patients in hospital that have the same name. But what you will do is always put a name on your patient. So you'll hit the name button, and this is Miss Athena. A little bit slow, sorry. And then you'll go down here and you can always hit your home button. Now, of course, it's like a normal keyboard, has the erase, backspace, etc. So I'm gonna hit home, and you see Athena's name has popped up, and now her ECG is reading with her heart rate to the right. Now this white line that you see spiking up intermittently is her respiratory rate. Now you can alter the size of both your ECG as well as your respiratory rate so that they do not interfere with each other. And what I actually would like to do, because it's kind of hard for me to see her ECG in detail at the size it's at, you'll touch on the number of her heart rate, and you'll see it'll say right here, it'll be ×1 respiratory ×1. You'll go down to size and scale. You'll hit size and scale. You'll see there's arrows and there's sizes. So what you'll do is you'll hit your size, and I'm actually gonna make hers ×4. And for her respiratory rate, I'm actually gonna go down on that if I'm able. And you'll go back to home. As you see, before you go back to home, your respiratory rate is reading right here in white. So once you hit back home, it'll go ahead and make those changes take effect on your screen. As you can see, my respiratory rate is no longer interfering with my ECG, and my ECG is reading much bigger so you can actually see the complexes. So at any given point, if you do need to print something, if there's an abnormality, and say you don't have notification parameters set on your machine yet, if there's something abnormal, there's this little button right here. Looks like a little squiggly hurricane. What you can do is you can literally hit that button. It will start printing from here. And once you hit that button, it will automatically print a certain amount of sets, and then it will automatically shut off on its own. And then once you're done, you do have it on here. This is where the name comes really important, and it will have their name at the very top of the strip. And as you see, perfect example, right now her heart rate says it's 227. The manual, you'll hit alarm silence. And what that will do is if any time at any certain point her heart rate goes above what the parameters are, it will start alarming, and you'll hear that sound. It will start flashing in red. To set your heart rate alarm, you'll go to the heart rate alarm button on the bottom. Make sure you're on your same patient. You don't want to interfere with another patient's parameters. Right now, in the middle, the purple is her current heart rate. Her alarm parameters are if less than 50 or greater than 140. In her case, we're going to set it higher than 140 as we're not too concerned with it being 140. Now, the most important thing to keep in mind, these heart rate alarms are at a doctor's discretion. At no point should you change an alarm without speaking to a doctor. Based on patients' different disease processes, toxicities, etc., it is not safe to say that any given parameters are specific to one, are universal for all patients. However, you can set specific parameters for any patient. If at any given point you need to turn your heart rate alarm off, you can simply hit off. We like to leave those parameters on, and I'm going to hit alarm silence just while I'm working on it. And what you can do is where it says lower and upper, you can hit the button and it will slowly increase your range. 165, 170. So I'm actually gonna go back down to 160 and leave it there. I'm happy with leaving my low parameter at 50. Once you've made your changes, you can hit home. That'll take you back to your home screen. Remember, home will always take you back to your home screen. If something happens and you need to see your respiratory rate, you hit your number where your heart rate is and your respiratory rate will appear down here. Now, as you see, there's a little bell, which we can go into later, that will alert you for specific heart rate alarms. I do ask that you do not rely on this machine strictly for monitoring respiratory rates, as sometimes it can be inaccurate with patient activity level, interference, etc. So it's always good to put visual eyes on your patient as well. Again, I'm going to hit my home button, and I'm going to say Miss Athena needs to go for a potty walk. So what you would do, so it doesn't alarm with her getting excited or moving about in her kennel, what you'll do is you'll go to suspend. You'll hit suspend. Are you sure you want to suspend monitoring for this patient? Yes, I do. I want to take her for a potty walk. We have different options. If there's something else that you may need to suspend it for, say she's going to surgery or you need x-rays and they're going to take 30 minutes. I'm going to take her for a potty walk. So you hit potty walk and it allots you an amount of time. I'm going to say 15 minutes. It says when the selected time has elapsed, it will notify by an alarm. That is correct. You'll hit 15 minutes. It'll automatically put that she's on a potty walk. Her name will go up here in the corner, so you'll still have that. Once that counts down and she runs out of time, it will beep and let you know that you do need to either hit resume or go back to suspend in case she needs more time. And what you'll do when she comes back is hit resume and it will immediately start reading again. Oftentimes if the bells go off and it's alarming, you can hit the bell that's blinking and it will tell you what the last time frame was and what was abnormal that caused it to alert. Once you hit cancel, that bell will go away until there's another. It can record up to 3, I believe 3 at a time. And that is how you set up a patient on the monitor.